Welcome all OET aspirants to our new video. We are speaking 8ers. Thank you for all the support, we do appreciate that. Please continue to watch, support and subscribe our channel. Kindly subscribe, and click the bell icon, for more updates and videos. Please share with your friends. Please follow our Facebook page. Speaking 8ers, for latest updates and materials, our aim is to make speaking tasks more friendly, and simplify them, by providing lots of ideas, and you can develop them into beautiful structures.
Today, we're going to discuss in detail about OET speaking, throat swab. You see the parent of a 6-year-old boy who has come to have a throat swab taken. You are providing some information beforehand. Before that, let's start with introduction and warm-up questions.
Good morning, my name is Jessica Capsaw. I am the examiner for the OET exam, conducting on 07 of June, 2021. Can you say your name for record? Good morning, my name is Alexa Cooper. What is your candidate number, please? My candidate number is 721567. And you're taking the test as a nurse, is that correct? Yes, that's correct. Can I see your ID or passport, please? Sure, here it is. Now, we moving to warm-up sessions. They are not assessed, basically, it's a chance to get each other's voices. In this part, I will ask you 3 to 4 questions, before we move to roleplay. Are you ready, Miss Cooper? Yes, I am ready. Do you believe in any gender difference in your profession? If so, what is your opinion? No, I don't believe in any gender disparity. Previously, it was a female-dominated profession. Now, the trends have changed, and there is a large number of male nurses in my profession. However, once my friend told me, male nurses are not allowed to work with female patients in some countries. How you deal with someone who isn't satisfied with your patient care? While I constantly strive to do everything I can for a patient, there are times when even that isn't good enough, and someone takes issue with my care. The first thing I have to be in that situation is to step back and really assess what's going on. Sometimes, even with all that, you find people who aren't happy with what you're doing. In those situations, I do my best to accommodate them without compromising their care. If it's a situation where I really can't fix the problem, then I work with the other nurses and doctors on my team to find an alternative solution. Why are you leaving your current position? While my last job was an opportunity for me to learn and grow at a comfortable pace in a smaller clinical environment, I'm looking for new challenges and opportunities to continue to expand my knowledge in a larger hospital-based environment. I am eager to try new things and learn skill sets that come from working in a faster-paced environment like this one here. Whom did you learn most in your career? I must admit, I learned a lot from my tutors, seniors, and my colleagues. But my real teacher is my own patient, because from them, I get a true picture of the quality of my performance. Thank you, Miss Cooper. That's the end of warm-up session, and let's begin roleplay. Here is your task, and can take 3 minutes for preparation. Thank you.
Mr. Richard and his son visiting clinic for throat swab. Father is having some concerns regarding the procedure. As a nurse, we need to reassure him and collect details for the reason for swab. Explain what is throat swab and its process. Clarify his doubts and convince him to go ahead with swab for his son. and finally establish consent for the procedure.
Good morning. Please come in and have a seat.
Thank you, nurse.
My name is Alexa Cooper, one of the registered nurses working in this hospital outpatient clinic. How can I address you?
You can call me Richard.
Hello, Richard. How can I help you today?
I am here with my son, Adam, for a throat swab. He is waiting outside, and I would like to collect some information before the procedure.
Definitely, Mr. Richard. But, to clarify your doubts, I need some background details. For that purpose, can I ask you some questions regarding Adam?
Sure, nurse.
How old is Adam?
He is 6-year-old.
What is the reason for doing throat swab?
He is having frequent sore throats.
When you say frequent, can you explain how often he gets sore throat?
If I remember correctly, he has it for almost 2 to 3 weeks, nurse.
Tell me, Richard. Is he had any swab before?
No, nurse. That's why I am a bit concerned.
I can easily relate with your concern, Richard, as my son is also the same age of yours. Let me reassure you, there is nothing to be alarmed about. It's a very simple procedure, and I will explain in detail, may I?
Please.
In throat swab, we take a sample of tissue from throat with the aid of a cotton wool bud. It's a very quick process, and he will have some slight discomfort, like minor risk of gagging. Is that clear to you?
Yes, nurse.
Since it's a very quick process, and to support, you can stay with Adam during the procedure.
Thank you. But, nurse, I don't think just taking a little bit of throat tissue can show what is wrong with my son.
I can sense your feeling, Mr. Richard. Once we collect the swab, it will be sent for analysis. During analysis in the lab, they will look for any culture growth and type of infection by doing some chemical tests. Are you following me?
Yes.
That's good. Now, tell me, Mr. Richard, does Adam use his mouthwash to rinse his mouth?
No, nurse, he don't use mouthwash. But, tell me, why you need to know about this?
I will explain. If he uses mouthwash, it can vary the final result. Because mouthwash can kill the bacteria and thereby, the test result will be compromised.
I understand. Nurse, my biggest concern is, what will happen if the throat swab shows some serious issues with my son?
I am afraid to say this, Mr. Richard. I can't provide a prognosis. First of all, it's not my role or scope of practice to explain the prognosis. Secondly, we are doing this throat swab to identify a correct diagnosis for Adam. And lastly, and most importantly, general practitioner is the right person to provide details for you, and once the diagnosis is confirmed, he will provide the appropriate treatment for your son. Are you getting my point?
Absolutely, nurse. I hope you can tell me, when will be the result available?
Sure, I can. The throat swab results will be available in 2 days' time. And doctor will explain the result in the follow-up appointment.
Thank you, nurse.
Being said that, do you have any more concerns?
No, nurse. You explained everything in detail, and I really appreciate that.
Thank you, Mr. Richard. So, can we proceed with the throat swab for Adam?
Of course, you can, nurse.
In that case, you can bring Adam inside and I will be back with the swab. It was my pleasure to speak with you, and wishing you a wonderful day.
Thank you, nurse.
Thank you guys for watching this video. We hope you guys learned how to do a beautiful roleplay discussion. Please continue to watch and support our contents. Press like and subscribe button to show your support. See you in our next video. Meanwhile, if you have any doubts or suggestions, please comment.